Good morning, everyone. Thank you for coming. My name is Ann Judith Lambert. I'm the Special Agent and a Public Information Officer for the DEA Miami Field Division. We have our great partners here today, to my left and to my right, who will be speaking today. And we will start off with Mike Furgason, who's the Assistant Special Agent in charge of the DEA Tampa District Office.
Good morning. I'd like everyone to imagine a beautiful day like today. You're at Raymond James Stadium. Nearly 70,000 fans are right to your left and right. Parents, kids, friends, everyone's enjoying the music. Excitement, and when it's over, they're all dead. In 2017, drug overdoses skyrocketed to more than 70,000 people. Of that, 47,600 were from opioids. That's 192 people per day, every day, for a single year. Our spouses, our sons, our daughters, our siblings, and parents. In Tampa Bay alone, there were 1,300 overdose deaths last year. DEA spent decades arresting people. We do it really well. We put together great cases with our partners that you see seated here today. That doesn't solve the problem. It's why we created the DEA 360 program. It wants to take the drug dealers, customers away. You can't poison someone with drugs if they don't have it. DEA 360 attacks the drug epidemic from all sides, every angle. We go after the bad guys, and we educate the good guys. Why is that important? We truly want to make sure the pain medication gets to those individuals that need it, but we want to keep it out of the hands of those that don't. If anything can be likened to a weapon of mass destruction and what it does to a community, it's fentanyl. It can kill you if you inject it in your arm, if you inhale it, or simply touch it. 1 gram, break this down to 1,000 milligrams, 2 milligrams of fentanyl can take you down. It's lights out, you recover. You hope that a paramedic or a first responder is there to assist you. Fentanyl's 100 times more potent than morphine and at least 30 times more potent than the heroin that we have on the streets today. This fentanyl, even for an experienced opioid user, can kill them. It's a mass killer. Doesn't care who you are, young, old, male, female, internationally famous, or more importantly, a kid from Tampa. Most kids looking for that high, quick high, they have no idea that the oxycodone pill that they thought was from a doctor is from their pusher, contains fentanyl. Or just that bit of heroin that they're gonna use is laced with this poison. Why are we here? The DEA 360 goal is to work with our community partners to educate kids, parents, adults that ingesting fentanyl is like playing Russian roulette with a loaded weapon and a bullet in every chamber. We want our kids to grow up and actually see their kids become kids. But we need your help. We're going after doctors, pharmacists that profit from pain pills getting into the wrong hands. We're working with the medical community to raise awareness and cost consequences associated with heroin and prescription opioid abuse. We're sending DEA agents out to schools, boys and girls clubs, churches, businesses. We're hitting social media. The media is here today, and letting everyone know that it's us, that it isn't us against them. We're Tampa. It's all of us together against the poison that's killing our community and our family members. And we've had success. Since DEA 360 initiated in other US cities, we've seen overdose deaths plummet. Dayton, Ohio, in 2017, had one of the highest record number of overdose deaths. The city made changes, and they've seen their deaths drop in 2018 to more than less than 50%. Our goal is to do even better in Tampa Bay. Together with our partners, some of whom you will hear from today, we want to reduce the number of drug-related overdoses. And thank you.
Thank you, Mike. And now we will hear from Maria Chapa-Lopez, the United States Attorney for the Middle District of Florida.
Good morning, everybody. As the United States Attorney for the Middle District of Florida, I'm pleased to join my federal, state, community, and local law enforcement partners to announce this joint effort, DEA 360. I'm here to announce that and to further our commitment in combating the flow of dangerous drugs that impact negatively on all of our communities. This is a priority for our office and for the Department of Justice. We're committed to working in a strategic fashion with our partners to eradicate the illegal trafficking of and access to illicit drugs in the Middle District of Florida. That is, for the Middle District of Florida, it's our Tampa Bay community, it's our Jacksonville community, our Orlando community, and our Fort Myers community. So it is important because it affects all 5 areas that are the Middle District of Florida. So I am very excited to embark on this with our local law enforcement partners and our federal law enforcement partners because it affects all of our communities. As part of that commitment, I've designated a district-wide opioid coordinator to prioritize and coordinate the prosecution of these cases involving the trafficking and the catastrophic deaths resulting from the illegal use of opioids, such as fentanyl, as Mike mentioned in his introductory remarks. In 2017, the United States Office created the Opioid Fraud and Abuse Detection Unit, and we were one of 12 districts in the United States designated by the Attorney General's Office to have that kind of unit, to create that kind of unit. And within that, we work closely with our investigative partners and focus on prosecuting medical professionals who prescribe opioids outside the scope of their professional practice and for no legitimate purpose. Our attorneys in the United States Attorney's Office, both criminal prosecutors and our civil attorneys, both work jointly to take a multi-pronged approach by using every tool in our arsenal, as also Mike mentioned, to stop the flow of these dangerous prescriptions and these dangerous drugs for profit. We target the illegal distribution of pills and other narcotic substances by anyone that poses a threat to our communities and to our children. Additionally, our violent crime and narcotics section is headed up by Assistant United States Attorney Chris Murray, who is here in the audience today. That section vigorously supports the Department of Justice's national priority to combat the opioid epidemic by aggressively prosecuting those who use violence as well as drug trafficking to further these criminal activities. And to date, the narcotics, the violent crime and narcotics section has had a level of success working closely with our local law enforcement partners as well as our federal and state law enforcement partners and our local civilian community. Finally, in the partnership with the DEA, my office's law enforcement coordination team works to identify communities hardest hit by the opioid crisis. And we have convened multiple interdisciplinary forums and technical assistance training for law enforcement and public safety personnel throughout the Middle District. Since 2017, more than 500 law enforcement officers in our Tampa area community and medical professionals have been trained in dark web investigations because unfortunately a lot of this trafficking that attracts our children is done through the dark web. Also to be trained in reporting and prosecution of opioid overdose cases, which sadly is a crisis and an epidemic here in our community, and the safe handling of dangerous substances such as fentanyl by our first responders. All areas that are crucial to tackling and battling this epidemic. In 2018, at least another 1,000 citizens were educated on the dangers of opioids and how they may assist us in this fight. In partnership with the DEA, the FBI, local law enforcement agencies, educators, medical examiners, and faith institutions, our community outreach team has helped to coordinate the viewing and subsequent discussion of the film, Chasing the Dragon, The Life of an Opioid Addict. Through the use of that film, we have also done significant outreach to our local schools to educate our children on the dangers of opioid addiction. After the viewing of that film, citizens worked together to develop local strategies to further educate and prevent and provide treatment for those affected by this crisis. In closing, I'd like to say that you can rest assured that we in the Department of Justice and the U.S. Attorney's Office here in the Middle District of Florida will continue to educate our communities, to train our partners, work closely with our partners to investigate and prosecute to the fullest extent of the law those who seek to poison our communities to hurt our children with these dangerous drugs. And we applaud our citizens for working closely with us to accomplish together what we cannot do alone. Together, all of us sitting up here and all of you out there, we are the force multiplier to go after this epidemic. Together we are a team, and together we can do this and succeed. Thank you.
Thank you, Ms. Chapa-Lopez. We will now hear from Ashley Moody, the Florida Attorney General.
Good morning. This is a special morning for me. Not only do I join friends who have lost immediate loved ones and still suffer from the tragedy that was inflicted on their families from this crisis, I sit alongside former prosecutors who worked with me in aggressively attacking those organizations, drug organizations that prey upon the most vulnerable in our society. I also stand before you as a Tampian. Until 3 short months ago, when I was inaugurated as Florida's 38th Attorney General, I lived among you, right here in Tampa. And proudly, as the wife of a career law enforcement officer, a DEA agent, I am honored to be a part of this effort and proud of the Drug Enforcement Administration in their recognition that we cannot arrest our way out of this crisis. That in order to make meaningful strides against this opioid epidemic, we must not let up on our efforts against going after aggressively those that are trafficking in opioids. And that means from large criminal organizations that are pushing them across our borders, that are bringing them here from other countries, moving them into Florida from other states, but also holding responsible large organizations, corporations that have added and contributed to this man-made crisis. In the Attorney General's office, we are committed from attacking this from all fronts, aggressively pursuing criminal actors and making sure that those that are addicted to these drugs have the services in place that they need. And that is why I commend DEA for DEA 360, because they acknowledge that in addition to our law enforcement efforts, we must reach out and make sure that our partners in the addiction communities are there to provide services as needed, medication-assisted treatments, and that our first responders are equipped to respond to overdoses with the life-saving drugs that can be provided to them through resources and partnerships through our offices. As we sit here today, first responders will be dispatched to an overdose. Luckily, many of them have these life-saving drugs. Hopefully that life will be saved. But if you've kept up with this crisis and the research, you know that many of them will go on to overdose. By the end of this evening, while people are watching footage of this press conference, we will have lost 17 lives today, just in Florida. I was honored to be appointed last week by Governor DeSantis to lead our statewide task force to attack this epidemic. I am committed to using the resources of the Office of the Attorney General to complement what DEA has so boldly announced this morning. And I thank you for your efforts, for all of our partners here, State Attorney Warren, Sheriff Chronister. You have a partner in the Florida Attorney General's office. Thank you very much for being here today.
Thank you, Ms. Moody. You will now hear from Chad Chronister, Sheriff of Hillsborough County.
Good morning, everyone. General Moody, thank you. Thank you for your leadership. Thank you for being such an advocate for law enforcement and providing the tools, resources, and training that we need to keep our community safe. As I stand here, I feel so privileged to be aside so many of our federal, state, and local Tampa Bay law enforcement agencies that work so hard day in and day night to keep our Tampa Bay communities the safest places to live. We all know that we're not going to arrest our way out of the opioid crisis. It's not unlike any other crisis. Sure, when you look at the men and women represented here, you can't help but feel a sense of pride because of the great work that they do when it comes to the enforcement effort. They're good at what they do. They're working hard to take the dealers off the street, whether it's the dealers on the street or it's the dealers with the prescription pads. They do a wonderful job. But we know it takes much more than that. It takes treatment, getting the people who become addicts, getting them the treatment that they need. And then equally as important is the prevention, the education. I couldn't be more grateful. I couldn't be more proud. I couldn't feel more privileged and thankful that the DEA has now brought the 360 program here to the Tampa Bay area to help us combat this crisis. This is another tool in our arsenal of resources that will help us win this battle against the opioid crisis.
Thank you, Sheriff Chronister. We will now hear from Dr. Julia Pearson, Chief Forensic Toxicologist for the Hillsborough Medical Examiner's Office.
I'm here today to speak on behalf of the victims and their families of the deadly consequences of drug overdose. In 2013, there were only 3 fatal heroin overdoses in the entire Hillsborough County in the entire year. Sadly, last year in 2018, 153 people lost their lives in this county due to heroin and fentanyl overdoses. This is an unprecedented increase that has reached epidemic proportions. It affects all walks of life, with victims' ages ranging from 17 to 75, from professionals to students to athletes to healthcare workers to retirees and to the unemployed. It affects everyone's lives. Heroin and fentanyl analogs are extremely potent and deadly. Injecting or snorting these drugs is like playing Russian roulette due to the extremely high risk of a drug overdose. Often the victim may unknowingly purchase one of these deadly drug cocktails off of the street. Shortly after using the drug, they may lose consciousness in seconds and die within minutes, sometimes even before the antidote Narcan can be administered. Every drug overdose is a call for action. The criminal justice system, in combination with education, prevention, treatment, and rehabilitation, must work together in order to fight this deadly epidemic and save lives. Thank you.
Thank you, Dr. Pearson. We will now hear from Mark Brutno, Special Agent in charge of the Florida Department of Law Enforcement.
Good morning. I'm Mark Brutno with FDLE, and we are excited to join the other agencies here today to promote the DEA 360 strategy. Whether or not you have personally been impacted by the cycle of violence and addiction that surrounds drugs, it really is an issue that hurts all of us. FDLE is committed to doing its part to eradicate this cycle. We have agents assigned to drug task forces throughout the state. In Tampa, not only do we have an enforcement presence, but more concerning is our crime laboratory received more than 10,000 submissions of seized drugs last year alone for analysis. No doubt the drug trade is big business, but we know that initiatives like DEA 360 can make a dent, and quite candidly, a difference. Again, we're glad to be part of this program and look forward to working with our partners in this program. Thank you.
Thank you, Mr. Brutno. We will now hear from Andrew Warren, State's Attorney for the 13th Judicial District of Florida.
Good morning, everyone. First, let me thank the Special Agent in charge, Furgason, from the DEA for leading the task force. And also, I want to welcome our Attorney General back to Tampa. In the 3 months, a little more than 3 months, that she's been in the Attorney General's position, she's focused on human trafficking and the opioid epidemic, two crises that hit not only the entire state of Florida, but right here in Tampa Bay. I've had the opportunity to stand with mothers and daughters mourning lives lost to the opioid crisis. This is not a law enforcement problem. This is a healthcare crisis. So many people who suffer from addiction need help, not handcuffs. They need prevention, not prisons. DEA 360 is a comprehensive approach. It encompasses, as you've heard, the law enforcement piece, the clinical piece, and the community support piece. With me from my office today, we have our chief of our drug trafficking division, as well as our problem-solving courts. Because from the state attorney's office perspective, those are the two pieces that need to work together to attack this problem. And even though I'm joined today by law enforcement partners, we know standing here that this goes beyond law enforcement. It requires the help of clinicians and experts in our entire community. DEA 360 is their starting point for this community to go forward attacking this problem. We know we need to do a better job, and we will do a better job. Our children's lives depend on it. Thank you.
Thank you, Mr. Warren. We will now hear from Ellen Snelling, Chairman of the Hillsborough County Anti-Drug Alliance.
I'm here representing the prevention coalitions in our state. We're on the front lines of fighting the opioid epidemic because we're here to prevent substance abuse before it starts. I feel so privileged to be here with all these leaders from our county and our state. We're all working together to stop the opioid epidemic, but we must get back to the roots of the epidemic, which is substance abuse at a young age. My life, as well as probably everybody in this room, has been impacted by substance abuse. I lost my brother 2 years ago to a carfentanil overdose. You heard how strong fentanyl is? Carfentanil is, I believe, 100 times stronger than fentanyl. My brother started in middle school with marijuana. And I just want to make that point clearly that marijuana is a gateway drug that can lead to hard drugs such as heroin and fentanyl. And that's what happened in my family. My brother is another one of the statistics. The 17 people lost each day in this state. Their mothers, fathers, brothers, sisters, children. And they have a ripple effect on everybody. So we've got to do more to save these lives. And again, I appreciate law enforcement's work so much. They're on the front lines of fighting and putting their lives at risk for all of us and all of our other partners in this room. And like I said, I just want to make the point that prevention is extremely important. Thank you.
Thank you, Ms. Snelling. We will now hear from Mike Jenkins, the captain of the Pasco Sheriff's Office.
Good morning. Boy, it is such a privilege to be here to speak with you all today, and on behalf of Sheriff Chris Knockel, I'd like to express our thanks and our full support to this initiative with DEA and Mike Furgason for bringing this to the Tampa Bay area. I hope that everyone who is watching today is encouraged by the comprehensive nature of what's being communicated today. Right? It's been said before by many of my esteemed colleagues, and I'm going to say it again. Law enforcement recognizes that we cannot arrest our way out of this problem. Certainly there's a supply issue, and we acknowledge that. But oftentimes from a law enforcement perspective, we experience kind of a whack-a-mole syndrome, right? We identify sources of supply, we put significant amounts of resource in identifying them and holding them accountable to the fullest extent. And because of the profit involved, it's not very long before that void is filled again. And so certainly you have heard a robust strategy from law enforcement that says, we're gonna do everything we can to identify who these people are that are dealing in death. We're gonna hold them accountable to the fullest extent of the law. But there's also a demand issue. This is not just about supply, it's about demand as well. So as you look at this esteemed group of individuals next to me, you will find that we have people from the medical community, people who understand the importance of prevention, recovery, and treatment, because we recognize that a law enforcement solution alone is inefficient. It is instead an integral part of a multi-pronged strategy that has to be implemented in concert and in unison in order to be as effective as possible. So again, I'd like to thank DEA. I want to express the full support of the Pasco Sheriff's Office and Sheriff Chris Nacco on behalf of this initiative. You can be assured that we're going to continue to pursue, again, robust law enforcement perspective. We're going to continue to pursue great relationships like we have with Baycare in our jail system, and in having some of their representatives respond to our search warrants where we can get people access to resources at their lowest point when we're hitting a drug house. There are many other wonderful initiatives that we've implemented and other law enforcement agencies that have implemented. We want to assure our citizens in Pasco County who have been dramatically impacted that we are committed to this. We're going to be strategic about it, and it's going to be comprehensive. Thank you.
Thank you, Captain Jenkins. We will now hear from Kent Gady, National Director for the Elks Drug Awareness Program.
I'd like to introduce Elroy the Elk. Let's give him a big hand. Okay. Thanks to the DEA for having me. I get around, I see a lot of them because there's not many of these that I miss. I am from Iowa. I'm native Nebraskan. Yes, I am a Husker, so don't hold that against me. I am been involved in the drug program, awareness program, as far as education, because education is the key. And we have the best educational materials that are available today at no cost. Realize that the Elks Drug Awareness Program is made up totally and entirely of volunteers. I used to teach school as a psychology and economics teacher. Didn't really understand economics, so I went into the insurance business. But anyway, the fact of it is that I believe in what we can do as far as an organization to help each and every one of you. The material that we have is the best there is. Why? Because we get a lot of it from the DEA. The thing of it is that you don't understand is that we have so much more that is available. SMOSH, remember the word SMOSH, S-M-O-S-H, Elks Drug Awareness. You go on YouTube and you'll see two of the finest videos available for anybody that will have their kids watch it, to use it in school, and it is a joint effort of the Elks Drug Awareness Program and the DEA that brings that about. I've been involved with this program for 30 years. The program is 35 years old. I have a very deep passion for it. If I don't have passionate people working for me, they don't work very long, because the simple fact is we have to be passionate about that. I've been asked many times why. Very seldom do I share this story. I have a son who is now 39 years old. I didn't have him until he was 4 years old. When he's 4 years old, his mother and father, when he was conceived, decided that cocaine was a cool thing. So Levi was born a cocaine baby. Well, his father was killed in a motorcycle wreck high on Jack Daniels and cocaine. Mother had another boyfriend, and they liked their cocaine and every other drugs, until one night the world fell apart for them, and he took out a gun and shot Levi's mother right between the eyes. Levi was standing there watching the whole thing. The guy evidently felt bad about it, so he shot himself. 4 hours later, they found my son in the bedroom with two dead people with holes in their head. Now that really gets me angry. And I don't lose well, folks. I'm a former coach, had a lot of victories, but I haven't had one as near as important as it's going to be when we whip this thing. So understand that it affects each and every one of us, and we're not going to quit. The Elks will never go away. We do not depend upon anybody but ourselves and the DEA to help us get our things done. So when you need something, we have it. It's the best there is. And thank you very much for having a guy from Iowa who is still a Husker. Thank you very much.
Then, Mr. Gady, I thought we were going to hear from Elroy. We will now have Pastor George Wood from the Tampa Underground Church and also founder of the Timothy Initiative.
Good morning, everyone. It's really an honor to be here amongst such amazing people, the law enforcement, and just all of the people that are laying down their lives for such an amazing effort. In 2005, I was able to finally find recovery from a long-term substance abuse and alcoholism. I also found my faith at that point, and it was going to be needed. I was going to go through some very dark times in the years to come. In 2009, I went through a 7-month stretch that formed me into the man I am today. And on July 3rd of 2009, my sister Susan died of a drug overdose, opiates. 7 months later, my brother James died of a drug overdose. My brother James was a up-and-coming lawyer for a major law firm here in Tampa. He had went to Stetson University and then went to Harvard to receive his LLM. He was not your usual street person that you might think was getting high. I watched these drugs take out two of the most important people in my life, and I decided to lay down my life for this cause. I started a ministry called the Timothy Initiative, which works with broken men coming out of addiction. In this past few years, I've seen over 800 men come in and out of our doors. 95% of them come in because of pill habits, opiates. I've lost more men than I can care to count. You've heard about supply, you've heard about demand, you've heard about prevention. I am the expert in recovery. I am proud to say that of the men that I have, I see more long-term recovery than any other type of establishment like ours. I have a group of men that have multiple years of recovery because we found out what the secret is to recovery. We've also know it's the same secret to keeping people from doing drugs in the first place. It's community, folks. It's having a purpose to live. It's having a reason to wake up each day and to live the life that you've been given. And that comes from doing life with one another. In the community of the Timothy Initiative, our brothers do that, and we try to be an example to a city that otherwise needs an answer for this opiate addiction. Thank you for your time.
Thank you, Pastor Wood. We will now hear from Jackie Siegel, a founder and philanthropist of the Victoria Voice Foundation.
Hey, good morning. I'm sorry for your losses, Pastor. I'm here today with my wonderful husband, David Siegel. He owns Westgate Resorts, but you also, most people know us now from the documentary, The Queen of Versailles, which was about us building the largest home in America. And unfortunately, we're here today as the face of parents who have tragically lost a daughter, 18 years old, Victoria, from the drug epidemic. And we're proof that the drugs have no respect for race, religion, or income, or hard work. Drugs do not discriminate. And we started the Victoria's Voice Foundation after she passed away. And part of our foundation, we educate people about the importance of drug testing your kids. And also, we helped to pass the CARA Act in Washington, D.C. after our daughter passed away, which we got over $1 billion allocated to provide naloxone to all of the first responders and colleges all across the country. So we're very proud of the strides that we've made since our daughter has tragically passed away. And when our daughter passed away, she left a note of where her diary was. And in her diary, it follows her through her testing and experimenting with drug addiction. And she tragically, unfortunately, dies at the end. And this book is now #1 on Amazon in the drug and recovery section. And our mission is to help people, to educate them about things that we wish that we had known. This happened, our daughter died and did drugs right under our noses. And we wish we knew then what we know now, and we want to share all the education with other parents. And do you want to say something, honey?
I'd like to add that, first of all, Ms. Snelling came up with a point that I think is very important. You may have overheard it. Marijuana is the gateway drug to cocaine, heroin, and everything else. Kids start experimenting with it when they're around 14, 15 years old. The only way we're going to end this epidemic, the only way, unless somebody can come up with another answer, is we have to do drug testing in middle school. Drug testing is the best way to keep a child from starting drugs. The fear of getting caught is the best deterrent to starting. If they have already started experimenting with marijuana, is to get them to stop, and it's the best defense against peer pressure. When their friend says, hey, be cool like me, smoke a joint with me, they can say, hey, I'm as cool as you are, but I'm afraid I'll get caught. There's too many parents out there right now, like ours, like us, that have lost a loved one, and we have to end this epidemic. Every day, it's like an airliner crashing with 200 passengers aboard. Can you imagine? You know, this Delta had, not Delta, but Boeing 737 MAX. They had 2 crashes in the world, not in the United States, and they grounded the entire fleet. This is equal to a plane crashing every single day, and what are we doing about it? This is wonderful what we're doing here, but this is not enough. This requires 100% effort on everyone's part. I'm a member of the Orange County Heroin Task Force. I'm a member of the Seminole County Heroin Task Force, and all I hear is a lot of talk, but not a lot of action. I hope today starts the action period, because that's what it's going to take. And while I'm up here, for those of you who don't know what this is Narcan. This will treat somebody that has overdosed. They're laying on the ground, turning blue, one breath from death. Police officer, the first responder, puts this in their nose, pushes this little button on the bottom, and within 2 to 5 minutes, they will come to life and tell you what they took. It's called the Lazarus Drug. It brings people back from death. Very few addicts parents, very few people know what it is. It contains naloxone, which is the antidote to a drug overdose. Naloxone was invented in 1971, 48 years ago, and very few people know it. This is the difference between life and death. The first responders that came to my home when my daughter had overdosed did not have this with them. Orange County Police Department and Sheriff's Department did not carry this until I got them to carry it 2 years ago. They've saved over 2,000 lives in Orange County since they carried it. This is very important to know, Narcan, but it buys 90 minutes of life. You can't just treat somebody and then let them go. They have to get to the emergency room, start the detoxing, because the receptors in their brain that were covered by the drugs that they were taking that caused them to lose consciousness are still there. So you have to get them to the hospital within 90 minutes. But the only way, as I said, we're ever going to end this epidemic is to start drug testing kids in middle school and also arrest the drug dealers that are. 1,300 people died in Tampa last year. There should have been 1,300 arrests for murder of these drug dealers that are supplying the drug. Thank you. I could stay up here for hours and talk to you about it.
And I just want to add one more thing.
But I've taken up enough time. Thank you.
And I just want to let everyone know, we brought copies of our daughter's book. If anyone wants a copy, they're over in the corner over here. And most importantly, I want to thank everyone from the Tampa 360, the DEA, and Ashley Moody, and everyone for coming here and forming this organization. Thank you so much.
Thank you, Mr. and Mrs. Siegel.